Thank you ever so much, everybody, for joining today. I think we have just about enough people to make a start. We've got quite a few things to cover today, so we'll get going. So this session is going to be recorded for anybody who wants to view it afterwards, and it will be available in a few places, and we'll send it out after this meeting as well. So just want to give everybody a warm welcome to this short webinar. So I'm Zoe Strawbridge. I'm an analyst working in Public Health Wales alongside Zach Watkinson, Matt Jones, Jacqueline Green and Louise Steens. And we have been working the past few months on developing the SHRN dashboard, which has been published today. And you'll be able to see that at the links that we can share on the Q&A section as well. Really great to see that this is of interest to so many people, and really good to get so much interacting with you guys as well. So this webinar today is going to be covering a bit of background on what SHRN is, and then it's going to go straight into a demonstration of how to use the dashboard. So we will have space for questions and answers. So you'll see at the top of the screen, I think, there's a Q&A button. And in here, you're able to post questions you may have, and there's discussion points as well, should you want to add any there. So pop those in throughout the demo. We'll try and get through them all, and we'll try and make sure we speak about them as well later on, just to make sure everyone can hear it on the recording as well. We will also have 10 minutes at the end of this session to answer any questions verbally as well, if you prefer to discuss your question as opposed to popping it in the Q&A. So totally up to you. But yeah, we'll have questions at the end. So for the Q&A towards the end, we will have Leanna Angel and Edna Ogada from the SHRN team joining us. And we also have Lorna Bennett from the Welsh Network of Health and Wellbeing Promoting Schools. And they're going to be there to help us answer questions around the survey itself and also the implementation of survey results within schools. Okay, next slide, please. Okay, so you may be asking, well, what's SHRN? And that's absolutely fine. So SHRN is the School Health Research Network, and they are a collaboration who sit within Cardiff University under Decipher. Now, the collaboration includes us in Public Health Wales, Cardiff University and Welsh Government. And since 2017, every maintained secondary school in Wales has been a part of the SHRN network. And as part of their work, they've developed a health and wellbeing survey, which is completed every 2 years by secondary school children in Wales. And this survey has been run since 2013. So the coverage for this survey is really, really high. In the most recent year, so 2023, over 90% of schools completed it. And that is over 73% of all pupils in maintained secondary schools in Wales. So this means that the data is incredibly rich. It gives us lots of insight into secondary school children's health and wellbeing and behaviour. Now, we in Public Health Wales have been working with SHRN for a few years now, and our collaboration has been really successful. So previously, SHRN would produce a static PDF format report each time new data was published, and the historic ones are available on their website should you want to access those. And these reports covered really, really good topics and a really wide-ranging, but it took a long time to create this PDF, and potentially limited users' ability to take exactly what they needed from that PDF due to the static nature of it. So last spring, we in Public Health Wales worked alongside SHRN, and we developed an interactive online tool, so the dashboard, which covered some really key indicators at a local authority geography level and above, so a health board level and a Wales level as well. Now, following our successful initial publication, we received some really, really good feedback from users and from SHRN. And so from that, SHRN kind of came to the conclusion that the dashboard actually provided a bit of a better way of visualizing that data and getting the data to people faster. Therefore, for this year, for the first ever time, SHRN aren't going to be publishing a static PDF report anymore, and instead the dashboard that we're going to be demoing today is going to be the standalone product to present the most recent 2023 survey data. Now, utilising a tool like this means we're able to push the data further than ever before. It allows a comparison over time from 2017 to the most recent data in 2023. And it means it provides us a really unique kind of pre-pandemic baseline to see how health and well-being was affected by the pandemic and how adolescents have recovered from that and in the years following it as well. So it's really exciting. And just go to the next slide, please. And so in the work we've been doing in the past year or so, there's just a few things to go through really. So the team's been working really hard on improvements and additions to the updated dashboard that we see today. And the points that you see here on the screen just show a handful of these changes. So it includes an update to all the indicators where possible with the most recent 2023 data. We've also included a new mental health question, which is the SDQ, or Strengths and Difficulties Questionnaire, which my colleague Matt is going to be demoing to you later this afternoon. Also, for the first time, we've been able to add a gender breakdown for students who reported their gender as neither word describes me. And we are presenting this data at a national level only, so just at a Wales level for the minute. And that's mainly due to very small numbers of responses of these people in the survey. But we hope in providing data for this group, we're able to support schools and policymakers in identifying support for this group that they may need. So looking through the extra things we've added in, following feedback, we've actually added the ability to view data by year group as well, rather than just age, as we were aware that some people really liked having the year group element in there. And we've also been hard at work with improving the way that you view the data as well. So we've added in some trend charts and we've added in some easier to use comparison bar charts. And my colleague Zach will be showing you those in a little minute as well. So that's kind of the overview, a very brief overview of the updates we've created so far. So without further ado, I'm just going to hand over to Zach and Matt, who are going to take us through a demonstration of interacting with the dashboard and how best you might use it in your own work. So over to you, Matt. Zach, sorry.
Thanks, Zoe. So I'm just going to start off on our landing page. So here's the landing page, and we have like the big link here to our dashboard. So this is where you can go and visualize the data. We also have a complete data download here. So if you want an Excel document and look through that data yourself, we also have the response rates here and a dashboard user guide. So if you're first new to the dashboard, you can have a look through that to help you. And below we've got like the start of our key messages here. And these are some of the things we've like spotted looking through the data. And yeah, so I'm going to take you through a little demo looking at physical activity and exercise, and we're going to visualize these in the actual dashboard. So here's the first dashboard homepage, and we want to look at physical activity. So in this top green bar, we're going to click on physical activity. And then below here, you see they've got the secondary topics, and we want physical activity here. So what do we want to look at? So we want to look at the percentage of children meeting physical activity guidelines has risen back to levels last seen in 2017, and look at this boys and girls. So here's the 2023 data. We want to see it from 2017. So we're going to click on the trend in this left-hand side box. And that gives us a nice line chart of Wales, but this is all persons, and also the axes go up to 100, so it's not best to see changes. If you just want to look straight at the data, you can scroll down a bit, and here we have a nice little table with all the years in, and you can explore the data that way. However, we want to look at the data ourselves and male and female, so we're going to click male and female, and that'll bring us to this nice little chart of them next to each other so we can compare them. But again, this is very like flat line, you can't see as much, so we could actually visualize the data and look at 2021 to 2023 changes. So if I click the compare 2023 to 2021 button here, that brings up a nice bar chart that showed you 2021 to 2023, and you can see the increase there. And we can also look at this with males and females. So the next key message we want to have a look at is physical activity tends to decline with age or school year. So to have a look at this, we could go back to the 2023 data, go to persons, and have a look in the select breakdown here in this left-hand side and select age. And here you can see it creates a chart. We've got the age on the side here, 11 to 16, and you can see how it's declining. And exactly the same thing, if we click on year group, you've got the same trend. And we also have a nice Wales line here, so you can see what the average is across Wales. And then finally, we want to look at how family affluence impacts vigorous exercise outside of school time. So to do this, we're going to actually have to change our topic. So we're already in the physical activity bar. We want to switch over here in the second bar to exercise. And here we just want to go back to 2023. And now we want to look at family affluence scale. So we have that down here in the breakdown. If we click this, we get a nice little bar chart here of just 2023 data. And we can remove. So if we want to remove the middle, we can just see high and low. We could put that back. And then we also could visualize this over time in a trend. So if we click on a trend, you can see a nice chart here, and this has a Wales line in it as well. So we can remove the Wales line, so it's just high, middle, low. We could also remove the middle line, so we can just see high and low. And we, in here, want to have a look at the larger gap between boys and girls. So we can click male and female in the gender. You get a nice chart here. And then you can also download this to use on like PowerPoints, like presenting. So if you just click the download image button just below the chart, that should bring a download, and you can literally just copy that and place it into, for example, a PowerPoint here. And there you go. You can use that for however you would like to present the data. So that's the first part of the demo, and I'm going to pass over to Matt to do the second part.
Thanks, Zach. Just share my screen quickly. Okay, so yeah, I'm going to go through the dashboard to look at the new strengths and difficulties indicators. So the new indicators can be found in the well-being and emotional health topic. And as you can see, we have a few SDQ indicators, but for this demo, we're only going to look at the total SDQ score. So this indicator measures psychological problems and strengths, where high overall score indicates poorer mental health. And the total score is a combined score of 4 groups of questions, which are questions on emotional problems, conduct problems, hyperactivity, and peer relationship problems. You can see a bit more of the technical information in this technical info section underneath the table. So let's have a look at the data, and we're going to look at the trend for males and females. So I'm going to click on trend here, and then males and females in the select gender option. As you can see, there's an increase from 2019 to 2023 for both males and females. Females have a higher total SDQ score across the 3 years, and in the most recent year, 42% of females scored high or very high, compared to only 27% of males. So I want to explore this a bit further. So I'm going to break it down and look at males and females by year group. So to do that, I'm going to go to select breakdown and click on year group. And then we get an option down here for select year group, and I'm going to select them all. So by breaking down this data, we can see that in the most recent year, females in year 9 and 10 scored the highest out of all other year groups for both males and females. So I want to now download the data, but I only want to have year 9 and 10. So I'm going to remove the other years from the input selection. And I'm going to click on the download data button just underneath the chart. So as you can see up here, the data has been downloaded in an Excel file. So this is what it looks like. So it contains 2 tabs. The first tab provides some technical information relevant to the indicator and any caveats belonging to the data. And then the second tab then contains the data that we've just downloaded. As you can see, we've only got year 9 and 10 because that's what we wanted to download. So that's it for the demo of the dashboard, I'll now pass over to Jackie. Thanks.
Thank you, Matt. Let me just share my screen. Hopefully you guys could see that. So what are we going to look forward to following this 2023 update of this dashboard? Well, first, more survey topics are in the works, as well as an update on the geography tab, those two. Back to the data and topic updates, we are looking to publish new data in 2 phases in the early periods of next year, 2025. I'll show you what kind of topics we can look forward to next year on the SHRN landing page found on the Public Health Wales website, so bear with me. So this is the landing page. If you scroll down to the bottom, this proposed publication timetable. You'll see the topics we have updated for this release. If you scroll down further, you'll see a list of new topics we're looking to publish with only 2023 data. We're going to publish them in 2 phases, with phase 1 looking to publish around February 2025. And if I scroll down a bit more, and then phase 2 looking to publish around April 2025. If I scroll back up, see what topics we have. These are the topics for phase 1. Expect possible new topics like e-cigarette use, smoking, vaping. Also expect new topics around school involvement, as well as age children first undertook risky behaviors. So for example, what age they first used drugs, drank alcohol, etc. I scroll down in phase 2. Expect new topics like breakdown on ethnicity for the 2023 data only, family support, as well as school truancy and exclusion topics. If you are interested in looking at the specific topics, please find them on the landing page, just right in the bottom, like I did. In addition, we are possibly going to add the historic data, so 2017 data and 2021 data for these new topics. Timeline for this is to be confirmed. I will caveat that these list of topics and dates are subject to change based on the availability of the data and our capacity. Another thing to note is the update of the geography tab. I'm just going to show you guys the dashboard for a second. If you click on the view by geography, you'll come to this page. We have omitted the geography bit of the dashboard for this update, as we received feedback to indicate that it wasn't as useful as intended for users. It is currently under development to ensure it fulfills purpose. If this was something you use regularly in the previous dashboard and you have feedback or suggestions for improvement, please get in contact with us. The email to get in contact with us is located on the dashboard page here. Public Health Wales, observatory at wales.nhs.uk. Back to this. So another thing to look forward to is small dashboard improvements. Look forward to the small improvements to the usability of the dashboard over time. This will be ongoing, so if you notice anything, let us know again to our observatory email. And last but not least, the development of the primary school dashboard. At the moment, data is being collected as we speak. We at Public Health Wales will receive this data at some point, and we have plans in place to develop a dashboard similar to this current one. We will be looking into possibly creating and publishing this new dashboard in late 2025, subject to data availability and capacity. Okay, so thank you very much for listening. We hope you enjoyed our little run through of the updated SHRN dashboard. I will hand you over to Louise, who will lead on the Q&A part of this webinar if you have any questions.
Thanks, Jackie. Yeah, so that's the end of the demo section. So yeah, I invite you all to either post any questions in the Q&A section or put your virtual hand up and we'll try and locate and unmute you. So there's been some questions in the chat box. I don't know if people can see that. So people asking whether they can share this webinar afterwards. Yeah, certainly do share it widely, and we're aiming to post a recording of this webinar on our webpage at the end as well. Reading some of the questions. So somebody asked about if the ethnicity breakdowns will be included in the dashboard, and yeah, as Jackie mentioned, we're aiming to do that for some of the 2023 indicators in next year, I believe in April, but that's again to be confirmed. Are there any hands up? I can't quite see. I'm just checking.
Just got one. Joanne, I try and unmute.
Thanks.
Hi, can you hear me now?
We can, yeah.
Hear you.
Yeah, I do apologise. I missed the first 10 minutes, so it might have been covered. I'm from an Iron Bevan local public health team, and I just wanted clarity on the geography tab that you mentioned, because from a local perspective, we're developing a joint strategic needs assessment on children and young people, and we've been waiting for the latest development and to break down the data by local authority level. So will we be able to access that at present, or is that going to come later in the geography tab?
Thanks, Joanne. Do you want me to take that one, Lou?
Yeah, sure.
Yeah. So when you look at the dashboard, so everything that was in the geography tab is available in the topic view. So you can break all of the topics down by local authority. So I've not got the dashboard up to give an example. Can one of the team share their screen for me? Just give an example of breaking down. Thank you so much, Jackie.
Bear with me.
So if you're on the topic page and you scroll down to, for example, where we were breaking down by year group, you can see there that there's also a breakdown by local authority. And here you've got all of the local authorities, so you can select and deselect at your leisure for all of these. So whichever ones you want to keep, and then those selections then should retain if you're clicking between different topics. That's something we've managed to fix for the improved dashboard this time round. So I don't know if that answers your question, Joanne.
Yeah, that's great. Thank you very much.
No problem at all. Thanks, Jackie.
Anyone else for any questions? Emma, let's see if I can unmute you. Okay, you should be able to speak now.
Thank you. I was just wondering, because I know we'll be asked this, are there any plans for a dashboard for individual secondary schools?
Leanna, are you there to help us answer this one, as I know this is something that SHRN is currently working on?
Thank you.
You there, Leanna?
Hi there, can you hear me?
We can, yes, thank you very much.
Hi Emma, thanks for your question, and thanks Zoe and team for going through the dashboard. Looks fantastic. Well done, everyone. Emma, yes, there is a plan for us to roll out our school level SHRN reporting dashboard. We're hoping to get it up and ready for the 2025 data collection. So reporting then will be in the 2026 sort of rollout. So yeah, there are plans, but that is to be confirmed at the moment. But that is in the pipeline. But I can't confirm anything at the moment. Is that okay?
Great, thank you.
Thanks.
Thanks. And I can see we've also had a question in terms of the charts, whether they need to start at 0 given the small change and therefore harder to visualize. Yeah, I appreciate it. It's quite small. There is a function that you can zoom in to see the actual percentages, and there are tooltips that show the value, and I guess it's best practice to really show the exact sort of change in that it's actually a small change. I think if we started it at say at 50%, then it might look bigger than it actually is. So yeah, I guess that's the theory behind it, but really value your feedback on that. Thank you. Hopefully that answers your question. Any more questions?
I think there was another question from
Oh,
Catherine Alreese. Any idea on when the primary school dashboard up and running?
Thanks, Jackie. Yeah, so we don't have an exact date. We're hoping that the data will be available to us at some point during 2025. But yeah, we're not sure of a date yet. I guess that depends on, yeah, again, when the data is available and our capacity.
Zoe, do you mind if I come in there as well, if that's okay?
Yeah.
So just to make people aware that we are, for the reporting of the primary school data, we will be producing hard copy reports for this round, just while we have in this transition period between what we're able to report on sort of hard copy and obviously for the dashboard development. Hope that's okay. Thanks.
Thanks so much. Okay, I think that's the end of our questions. So yeah, thanks everyone for joining. And as I said, we'll be posting the recording on the webinar for those who weren't available to join us today. But please, yeah, do share away and share the links to the dashboard with your colleagues and any interested parties. And a final reminder that we're really keen for any feedback. So please do send us an email or get in touch with us. Yeah, thank you and enjoy the rest of your day. Thanks.
Thanks all.
Thank you.